The next two portions of your physical assessment are with your lungs and with the abdomen, or with the GI system, the bowels. I'm going in a head to toe type of manner. You can go in any order that you want as long as they all get completed sometime in the morning of your physical assessment. Maybe you do a couple parts of it first, come back and do another part, but as long as they get done early in the morning at one time or another and they all get recorded into the chart. So with the lungs, when you look into your different resources, you're going to see that there's different amounts of sites of looking. Some references will say there's 10 spots, there's 12 spots, there's 2 over here. The main thing that you need to do is to make sure that you're following the lung, follow the rib cage, so that you're getting a full assessment of the entire lung. Remembering there's 2 lobes on the left, there's 3 lobes on the right. So you're going to just have your stethoscope, and what you're going to do is that you're going to start at the top and go down, following the contour, going over to the side. What I'm listening for is any adventitious sounds, rales, rhonchi, wheezes, and I would make sure that you know what each one of those are. What's going on when a person wheezes? What's causing the wheeze? So anyway, I'm going to start here, and I'm going to have them breathe in and out. Then I'll move over to the other side because I'm comparing right and left. In and out. I'll move down a little bit. In and out. In and out. You don't want them to hyperventilate, so don't rush them, and make sure they're taking deep breaths through their mouth. So all I'm going to do is I'm going to just keep going back and forth, following the lungs, over till I get to the side, and then make sure you get up by the armpit. That would complete the front side. I would make sure that I have the patient roll over. I do the exact same thing on the back, starting at the top, going all the way down their back, going back and forth, listening for adventitious sounds, and making sure I'm comparing right and left. So that is some of your objective things that you're looking for. Subjective, I'd look at them to see if they're obviously having a hard time breathing. Are they complaining of dyspnea? Do they get winded with activity? Ask them questions about their breathing. Do they cough? Do they have a productive cough? Does anything trigger? Do they have a history of asthma? Ask them some questions. Don't always rely about what you hear, because your patient knows what's going on the most. And that would pretty much cover it for my respiratory system. Last system that we're going to go over then would be the GI system. So the thing you got to remember about this, it's almost like your CPR. You're going to look, listen, and then feel. So the first thing I want to do is just look at the abdomen. Does it look rounded? Does it look like it's distended? Distended meaning that they're looking like they're pregnant and they're not. So just take a look at it and see what it looks like. Next thing we want to do is that we want to listen. Now remembering that the abdomen is in 4 quadrants, and you want to get a good listen in each quadrant. So you'd have your stethoscope, and you can start with the right lower quadrant, and you can listen for a minute, see what you hear. It's hard to count bowel sounds, but it can be done. Know what the norm is. How much is too much? How much is not enough? If they only have 1 bowel sound in that whole minute, that's a hypoactive bowel sound. If they have 55 in a minute, that's hyperactive bowel sounds. And if they have 15, that's active. That's within normal limits. So you're going to check all 4 quadrants for the bowel sounds. And they're just basically a gurgly type of noise that you're going to hear. Sometimes it'll fade off, and then it'll start in again. That'd be your second one. So I've looked and I've listened. The last thing I want to do is palpate. And basically what you're going to do, you're feeling, is it soft? Because we want a soft abdomen. Or is it hard? Hopefully it's not hard. So you're going along just palpating to make sure the entire abdomen is soft. The other thing that you're palpating for is pain. Are they having pain in the abdomen when you're palpating, or are they having a referred pain? Referred pain is when you press down on their abdomen and they say it hurts someplace else, whether it's in their shoulder or in their elbow. It hurts someplace else in the body when you're pushing down. That's referred pain. The other type of pain is rebound pain, and you see that a lot with acute appendicitis. When you push down, it doesn't hurt at all. As soon as you lift up, that's when they have the pain. That's rebound pain, and that is usually a positive sign of appendicitis. So I think we got it all on bowel. The one other thing that you want to check when you're checking your assessment is the skin. You want to make sure you've checked the entire body for skin, for any rashes, any redness, any breakdown. If they're complaining of itchiness, is there any cuts, bruises, anything of the sort. Measure them, and whenever you take measurements in the medical field, use standard sizes. A nickel is a nickel, so a nickel-sized rash is a nickel-sized rash. 50-cent sized piece reddened area. 50 cents, we all know what those sizes are like, or the size of an orange or an apple. They're all standard, and then because what large is to me could be small to you. So use something that everybody knows. But look for all those things and make sure that you document them carefully. So other than your vital signs, make sure that you got vital signs, whether you did that at the beginning of your physical assessment or at the end. But get your blood pressure, your pulse, your respirations, your temperature, and get the pain. Pain usually is your 5th vital sign. I think I said that before, but get all those vital signs. Know what the normal ranges are. What's a good blood pressure? What's a high pulse? What is a high pulse? That's tachycardia. So know your terminology so that when you're saying the words, you know what you're saying. So I've done that with my patient. I'll do all my standard post steps. I'll get his bed back down into a normal position. I'll make sure his side rails are up. He has his call light, he's comfortable, make sure he doesn't need anything more, and I go immediately and chart my findings. I'm not going to wait because I'll forget. So make sure you go and chart your findings right away, report anything significant to either the RN in charge, or you can go ahead and call the physician yourself and let him know. And that's it for physical assessment.